At what age did y'all start playing sports, if you play sports?
6, 7.
Alright.
3 or 4.
Did y'all play sports year round or just like seasonal?
Year round.
Year round.
Year round basketball too.
Yeah, year round.
Contact league.
Huh?
Contact league. And
Alright.
spring league.
Fine. Did y'all have any like injuries as young children? Like when y'all were
I did. I did. I still found somebody my finger got stuck in their face mask.
Alright. Well, I'm asking these questions because did you know overactivity in young children at a young age can cause abnormal bone growth in your hips called a hip impingement, which can lead to stuff like a labral tear. Yeah, and I'm gonna show y'all. I'm not gonna show you because I'm gonna show y'all like a little bit because I had the hip arthroscopic surgery. And what arthroscopic means, it's like you're not gonna get like cut up. It's not gonna show none of that. It's like a little like they stick something in you and it's like I gotta show you. It's hard to explain. It's really not nasty, I promise. I wouldn't show you if it was nasty.
Completion of the contract.
So look, this is what they do. So this is the hip right here, and they stick you three times. It's really not, they don't cut you up or nothing. And he's got these tools, these little things you stick the tools in, and it's got a camera on it with like a knife and stuff. And so when you have hip surgery for like if you tear your labrum in your hip, they will they just use that little knife with the camera on it to see what they're doing, and like they'll fix it up, whatever they do. I don't know the technical terms or none of that. But yeah, this is really all what they do. They just go around. You can see right here.
And attention is now turned to the acetabular
inside. This is inside your hip.
Complete bony exposure is performed on the capsular side of the labrum. 4.5 and 5.5 millimeter 4/8 resectors.
Alright, so that's enough with that. That's the exact surgery I had. So it's really not that bad. Alright, hip impingements and labral tears are really not something to play with, especially at a young age. It can cause such things as arthritis in your hips, and actually that will lead to hip replacements. These things are not supposed to happen in young adults and can make life very comfortable. I was diagnosed with what is called a cam impingement in my hip, and there's a demonstration. So this is what the ball of your hip and your hip socket is supposed to look like. It's supposed to be just regular circle so it can like rotate completely. When you have a cam, there's that abnormal bone growth you see right here. So that's exactly what I have. I still have it in my left hip. I got it removed in my right hip. So what happens when you have a cam impingement in your hip, when you rotate, it will grind away at the labrum, which is right here, and completely it will tear it eventually. And then there's ones called pincer, which is not on the ball of the hip, it's on the actual socket, which you see right here, which will do the same thing. And then there's some cases where people have both. I was diagnosed with the one called the cam impingement, which over time tore the labrum in my right hip and completely grinded away all of my cartilage in my hip. Wearing away the cartilage between two bones is what causes arthritis, and it's something that's very uncomfortable to deal with. And it's not something really you're supposed to get to until you're all like older, like 50, 60, 70, which is something I've had to deal with since 12 years old. My surgeon actually said he's never seen so much cartilage worn away at such a young age, and that he had the worst hip that he has ever seen. I learned all my information from him, and he's one of the top hip specialists in all America, and he has done like surgeries such as athletes such as Adrian Peterson when he tore his ACL. So he's incredible, and all of the information I learned from him. Hip impingement and labral tear can make everyday things such as sitting in a chair very uncomfortable. Like when I sit in class, when I'm sitting for a long period of time, like my hip will start hurting. That's because of like the arthritis in my hip. I'll have to like get up and walk around, stuff like that. I'm gonna have these problems for the rest of my life, so I know I want to make sure I limit my children from this, and make sure they aren't overactive at a young age, so they don't have to deal with the problems I have to deal with. My first main point, overphysical activity is one of the reasons why young adults get hip impingements and labral tears. Studies show that the number of hip surgery due to impingements and labral tears in young athletes is almost to the point that it's at an epidemic. One surgeon said he's done over 1,700 hip surgeries on young athletes, and the most are due to labral tears, which is from hip impingements. The surgeon said that he believes this is happening because young children are playing sports at a much higher level, as well as focusing on more than one sport at a young age. He also said the demands of training of young children have greatly increased, which can be another cause of hip problems in young adults. I know me as a young athlete, I never got time off. I started playing sports at 5, and all the way till now, I've never got a break. As a young athlete, once like one sport was finished, I would hop to the next sport, and sometimes I even played multiple sports at one time and never really given my body a break. Even like during 7th grade, I played 7th grade middle school football. I played on 2 teams at the same time, full contact, all that. Would go from one practice to the next practice in the same day. Now looking back on it, now that I have these hip problems, I wish I wouldn't have like jumped from sport to sport like that, and not played multiple sports at one time. Maybe then I wouldn't have these hip problems that I do now. Another point is strengthening and stretching of the hips at a young age can really help reduce the risk of athletes developing a hip impingement and tearing their labrum. Also, having good hips can, as athletes know, can make you a better overall athlete. And really, to be a good athlete, you really need good hip. As a young athlete, not once did I hear about something about improving my hips, strengthening, flexibility, or hear that it would make me a better athlete. Never heard that once from any of my coaches or trainers. Some of the exercises you can do, which are right here, you have the side planks with the dips. These are called clamshells, just show you demonstration. Bridges, simple bridges, and then these are called hip abductors. Those are things that all these will help you strengthen your hip and increase the flexibility, which will reduce the risk of a hip impingement and labral tear. Hip impingements and labral tears can cause a great deal of discomfort in your life, especially for athletes. It will limit certain things you can do on a daily basis, as well as limit you from being the best athlete you can be. Overactivity, not giving your body rest, and not probably stretching and straining your hips at a young age are major causes. But all 3 of these causes can be reduced. Hip impingements and labral tears are something not talked about a lot in sports, but it's becoming more common in athletes every year. The 3 points I made are things that need to become more aware to the sports world, as well as the consequences of them. I hope I've emphasized the importance of hip impingements and labral tears, and that y'all remember that if y'all have kids and when they start going into sports. Thank you.